Very good evening to meet you on this seven, Saturday 17th June 2023. We have achieved 1,176 cases of puberphonia today. Every day the number is increasing. At least 3 or 4 cases are coming every Saturday. So this is a Saturday too. So Monday, Tuesday, Wednesday, Thursday, Saturday, all days boys are coming. That their arrival itself encourages more cases of puberphonia and with more energy and more excitement, because this week I want to tell you one interesting story. One gentleman is a Bhagavatar, musician. He used to sing in sabhas in Chennai, 2 to 3 hours solo, and almost most of the Sunday or Saturday he used to have program in sabhas, and the remaining days he used to teach the students, take classes on music. What happened is, now his age is around 60. Somehow he is not able to get the old tone. So 2 days back he arrived to me to consult me regarding his voice. When he was just talking to me, his voice is puberphonic. I recorded the voice, why it is like that. But I remember many of the musicians are having little puberphonic tendency. Probably that may be attractive for the public to talk like a girl. Puberphonia, voice in music, pretty loving people. So I never, okay, this voice is good, but he says he is not liking this voice. So I asked him to sing a song that also we recorded and find out he is having a little puberphonic voice. He is a male and having few children also. So there's no doubt about his maturity as a male. And definitely, as a Bhagavatar, he is having a big hair, and I think, okay, and great Puttu also. So he is a male but having female voice. He told me that only in his old age he got the voice like that of a female. Now he want to change the voice to his original. Then I asked him to sing a song in that intensity or frequency he want. He had given a break and started singing, that also female. See, from the thing, but he denied that he is not having that voice previously when he is young and energetic at the 40th year. So I asked him to give the old notes. Then with his cell phone, recorded a cell phone, already he had few songs at his 40th year. So he played the song, surprised to hear that is what more ionic and male range. I have recorded the frequency when he had given the concert at his 40th year. It was more male. Then I asked him what happened. This is what going on for the last few years, more than 5 years. I am not able to realize that this is my not my original voice. Then he had consulted two ENT surgeons in Chennai, and the two surgeons they have done the larynx endoscope, and they told moving of the vocal cord. Then immediately I also did the endoscope and find out moving moving is due to atrophy of the vocal cord. So this is called as presbyophonia. Presbyophonia. So presbyophonia is a old age voice change. So this is due to the aging and resulted in change of the voice. Presbyophonia is one of the primary etiology of voice concern in the elderly, usually after 60 years. So this is usually it is happen. So after 60 years in singers, the prevalence is more than 50%. I know many good singers, including TMS. We know that his voice, as age goes, it is different. When we hear the voice of the great man Balasubramaniam in his younger days, when he was singing, definitely it is more attractive than the older, the next generation, what they are hearing, SB's voice. There was some change because one of the directors, the music director, he had requested S.B. Balasubramaniam to sing like the old tone. But whatever may be, he is not able to do it because of age. The voice changed. So this is what happened to that Mahavadar who had come and seen me. Few days happened. The ENT surgeon's endoscopic finding is moving of the vocal cord. I have also seen the endoscope picture of the vocal cord. Vocal cord moving. Moving means it is bent. Vocal cords are bent, and a gap is there when the vocal cord comes together. That's called adduction. So this is what happened for that. Because of that, the voice is not the pitch of a male. Because of the bowing, the voice is changed to high pitch. It is similar to ladies. So because we are going on hearing the musicians repeatedly, we won't appreciate the change in voice as female one. But when we record it, we'll be able to know the frequency for the same voice is just like ladies. There are many reports in olden days also. The famous singer Madi Iyer also lost his voice when he had become old. Sambai Bahadar also lost his voice when he became old. And probably what is the diagnosis in the structure, we don't know. Julie Andrew had a problem in the voice. Julie Andrew means was a very great singer, Gone with the Wind. Many songs. She had also lost the voice, and they suspected a vocal nodule and operated, and she lost her voice. This is what we know from the literature. But I know few of the singers underwent operation, they regained it. So old age is a problem for singers. When they become old, the voice is not strong. They used to tell, see, they are all big people. I am not saying that their voice is not good, but this is a popular belief. Even T.M.S. Soundarajan, when he was young, while he was singing, it was so attractive. When he little become old, and his market is also dull because of the voice, we can say. But few singers, in the old age also we have appreciated them a lot. Age goes, we appreciated them a lot, and their voice attracted us. So this is what going on in my mind. What is the reason for that? Old age also, you can have a strong voice. T.M. Soundarajan. When old age, why his voice is a little puberphonic? The probable diagnosis is vocal cord atrophy and bowing of the vocal cord. So thereby, what happens? Voice become hoarse, breathy, strained, and slowed rate. So the resultant feature is they are having decreased loudness, increased roughness, breathlessness, and the increased effort needed for phonate. They can or may feel fatigued. So this is what happening. This is what we are seeing it. And the old age, we are trying definitely. There are some surgical procedure. Atrophy is there means you can load it. Atrophy means the muscle structure in the vocal cord diminish. Their strength is less. So they are not able to work as when they are young. This is just like any muscle. So good surgical procedures are there. Vocal fold augmentation, or otherwise called as medialization of the vocal cord. Vocal cords are failed to meet in the midline. So you do the surgery in the vocal cord where it can come and meet together. Very good. And another procedure is also there. You inject some paste material into the vocal because muscle had become atrophied, the structure had become small, the structure is bowed, make it straight, make it thicker, and put some injections. So that also available. Augmentation or medialization. So definitely it is effective for short term. but it is having disadvantages because long-term effects are not much. And added to that, there are speech therapy, behavioral voice therapy, voice function exercise, laryngeal strengthening exercise. Definitely it is advantageous. Behavior exercise is shown to enhance overall muscle strength. Yes, you can increase the muscle strength. But there are disadvantages. No research is done on the effectiveness, and very limited number of testimonials on research on recurrent treatment method and uncertainty of long-term effect on laryngeal muscle. So these are the problems are there in my mind when we see a presbyophonia, old age voice change. So I am able to treat them very clearly, very easily by our uvula manipulation. Because these presbyophonia, the structural change of larynx due to aging, that resulted in a voice change, the impact changes often sufficient magnitude to be recognized by others. So music lovers find out that the old man, the old voice is not able to get it. So there is a chance that may negatively influence the listeners. So they had the feeling, the perception as an aged speaker. That may result in a negative impact on the functional use of the voice, and ultimately the quality of the life also decreases. So there is a pitch change, there is a hoarseness, there is a breathy voice, vocal fatigue. When you use it more strain and I think it double voice and inappropriate voice will be created. When we try more, you'll have a nasal voice, and lastly, it may go for a indifferent voice and inaudible voice. So this is a sequelae happening for old age people who is interested in singing or a orator. But we are able to succeed in treating because we have found out a technique that increase your audibility, loudness, and your roughness can be reduced. Breathness effect, nothing to affect your voice. You can have less effect on your lungs, still you can phonate well, and there is no question of fatigue. All the things we can achieve. How it is achieved mean, I'm having a very great feeling when you use your tongue and these two structures never become tired, never become fatigued. It won't stop in moving, provided you should make the airflow correctly to touch the uvula and tongue correctly and resonate the voice at the level of nose and sinuses. Few people are having the tendency from beginning itself, oratiles. They never strangulate the neck and talk. So if you want to preserve your vocal cord or larynx forever, and age should not hamper it, then from the beginning itself, you should be able to resonate the voice at the nose and sinuses. You have to talk with the tongue and uvula. How will you be able to do it means you open the mouth more and close it. Your speech should come from the whole body. It should not come from the neck. If you are using the speech from the neck with the enlarged muscles and other thing, that means you are strangulating it. You are spoiling your vocal cord. Then if you are spoiling your vocal cord, that will become tired, that will become fatigued, hemorrhagic spot will come, small nodules will come, and you will have a resultant bad voice. Whatever you talk and I think, so far in the literature, so many years, nobody had suggested by shouting you have injured your tongue. Nobody has so far found out that by shouting you have injured your uvula or soft palate. By shouting you have injured your nose. No report like that at all. That is a secret in my mind. If you are shouting for a long time, singing, definitely you can injure the vocal cord. But nobody had injured their tongue while speaking. No history of injury of uvula or soft palate when you talk for hours together. So why not you practice more by using your tongue and uvula, and you cannot injure your voice even at older age. This is what I have learned from big orators. They used to talk even at the old age very boldly, loudly, without any roughness, without any breathy effect. They are able to phonate without any fatigue for even hours together. That is possible because don't depend upon more on the vocal cord. Depend upon the resonance you are making. So there are some good methods in my mind so that can create a good voice. So this old age Puberphonia can affect any singers in their old age. So that will, in their old age, they may be great when they are young and singing, and they are lot of compliments. They are appreciated greatly. But when they become old, that will impact their own image and their life also. So what more we can do that will impact their physical and mental health also. So they will feel that no more they can talk or sing as they are young. This is what happening with more politician also. When they become old, they won't be able to handle the mic for more than 1 hour. But in younger days, they are able to handle the mic for more hours. So they will have automatically, when they become old, a politician, they will feel they won't be able to manage the crowd. No, they can. It won't destroy your self-esteem. Don't allow your voice to be puberphonic in old age. Your self-respect will spoil. It will create a low confidence in your in you, and it may result in a self-doubt. Oh, I am not able to do it. That may create an anxiety and depression. So this may your voice change in old age. Great politician try to remember the voice change have more effect on the social and psychological impact, and you will be misjudged as passive, immature, and frequently you may face teasing by even your friends that you have to manage the crowd. When your voice is not manly, then it may create a situation that you won't be able to manage your own friends, manage your own enemies, manage your own crowd. Even has that you are not able to do it. Then the situation change, that even in phone call, you never want to face the many hours. You will try to talk very little only. Then you will be have a depressed life, not only in your voice but life also. So this is what we have known so far. Our medical fraternity feel just like a muscle in athletic, your vocal cord also will become tired. But definitely, voice won't become tired at all, provided you know the technique. You know how you can orate, how you can pronounce, because it doesn't require more energy and doesn't require more support from the vocal cord. This is what my feeling. Definitely, vocal cords are necessary. That is the great thing. That is the thing. Just like a generator which makes the current. Yes, definitely, generator should be there. Current should be there. Nowadays, there are lot of generator is there, but step up transformer also available. Try to think like that. Generator is there, current is coming. Maybe water or chemical electricity current is coming to a place. But you can boost the energy with transformer. That is the technique all over the world they are using. Even small amount of energy which is coming from the lungs, from the air from the lungs, from small energy at the level of the vocal cord, the energy can be enhanced to a great extent by transformers. Where are the transformers? It is not in the vocal cord. The transformers are above the vocal cord, where the main switch is ula, which direct the sound to the mouth and nose. Even in this summer, we know current is coming from electricity. Electricity is coming from water or chemical or some means. But it can be distributed and boosted by generator. So place the generator and increase the amount of utilization, increase the strength of utilization. It may be a small wind instrument which produces a limited quantity only. But if a transformer is placed correctly, there cannot be more current cut and other thing. So similar way, I personally feel EULA is playing a very important role. This is what my understanding and my feeling and my research and my innovation. Why it is coming in my mind, birds. There is no EULA in birds. In soft palate itself, it is clapped just like cleft palate children. Cleft lip children, similarly cleft palate children. So similar structure only will be there in birds. So birds it can make noise, maybe a good noise or a music it can make, but it cannot talk because God had not created the EULA for birds. In animals also not having EULA at all. So we human beings are having EULA. That is why I am able to say that EULA is a major and accessory organ for speech. And moreover, every day now I'm watching the great wonder that in the world is, instead of entertainment with cinema and other thing, more people are interested in sports. If you open a TV channel, more channels are for sports than other things. So this also make me feel that my invention is correct. I will go and do some more invention in that direction. And my work, morning and night, I will try to continue, and I will try to meet you next Saturday. Meanwhile, tomorrow we are going to Kanchipuram for a seminar on Puberphonia. Dr. Armuham from Kanchipuram is arranging. So tomorrow whole day, morning to evening, we'll be in Kanchipuram. Monday will be only in the clinic. We'll hope and try to meet next Saturday, 5 p.m. Thank you. Great. Hope you great day forever.